Hello and welcome to our Monday edition of Arirang TV's special coverage of COVID-19. I'm Min Sun-hee. This past Sunday, Korea recorded 8 new cases of the virus, but authorities are calling for caution within the public and have extended a partially eased social distancing campaign as health professionals continue to seek a cure. We have more on that later on in the program, but first, as always, let's take a look at the headlines with our Kwon So-ah and Noaram. Welcome.
Hi.
Hello.
So let's start with you. So how are we starting the work week?
Well, it's been now exactly 3 months since the first case was confirmed here in South Korea. And I think we should start with the weekend, because on the weekend we saw on Sunday only 8 cases, which means that's the first time since 2 months that we have a number of new cases in the single digits. So today we have 13 new cases, also not a big difference as you can see here on our graph. So let's take a look at how things have developed since last week. On Monday last week, we had 25 cases, and then Tuesday and Wednesday 27, followed by 22 on Wednesday and Thursday. And then on the weekend, we saw that drop to 18 cases on Saturday, and then even plunging to 8 on Sunday. So with that, now the total number of confirmed cases as of 12 a.m. Monday stands at 10,674, and 236 people have lost their lives since the outbreak. We have more than 2,300 people still in quarantine, while more than 8,100 people have completely recovered from the virus. And now moving over to our map here in the capital Seoul, we had not a single new case of confirmed COVID-19 cases this Monday. We have 2 new cases in Gyeonggi-do province, Gyeongsangbuk-do province, and the city of Busan, and 1 new case in Incheon, Daegu, and Ulsan. Meanwhile, out of the new cases we have today, 7 new cases were from overseas, which includes 6 South Korean nationals. 4 were detected at the airport and 3 locally. Meanwhile, officials stressed today that the recovery rate from COVID-19 has exceeded 75% since the first outbreak here in Korea.
I see. Elsewhere around the world, I understand a funeral in Bangladesh this past weekend is raising concerns of a massive outbreak.
Right. An estimated 100,000 people have gathered to mourn the death of a Muslim political leader in the town of Sarai on Saturday, and they were ignoring social distancing measures. Local police said the crowds did not wear masks or other protective equipment during the funeral of Maulana Jubaye Ahmed Ansari, a senior official of an Islamist party. This despite a nationwide lockdown in effect since March 26th, which bans more than 5 people from attending prayers together. Authorities urged participants over loudspeakers to maintain social distance, but the situation reportedly became impossible to control. Bangladesh is one of the most densely populated countries in the world and is home to some 300,000 mosques. And 2,456 cases of COVID-19 cases were confirmed as of Sunday in Bangladesh, with 91 deaths. However, officials say the actual figure might be even higher due to the country's lack of testing kits.
Well, let's hope that there is not a massive outspread there. Meanwhile, over the weekend, I understand Japan has surpassed Korea with regard to COVID-19 cases.
Right. With hundreds of new cases confirmed in Japan on a daily basis, it now recorded more than 11,500 cases on Sunday. That's including the Diamond cruise ship. According to Japanese media, total cases in the country exceeded 10,500 on Sunday, following almost 370 new cases, with 712 from the Diamond Princess cruise ship, combined adding up to 11,514. The last number I checked as of Monday, it's 11,531. By prefecture, Tokyo has the largest number of infections with more than 3,080. Now, with a surge in cases, the country is reportedly dealing with a lack of masks as well as protective gear for medical staff. Now, we're moving over to the U.S. now. There are now more than 40,000 fatalities related to the virus, while in New York, it looks like the situation has passed the high point, as its governor says. Meanwhile, protests against stay-at-home orders are growing across the U.S. as people left without jobs are are skyrocketing. In fact, thousands took to the streets, including in Washington over the weekend. Now, for a closer look at the numbers across the world, the U.S. now has more than 755,000 cases, and in Spain, the death toll has exceeded 20,000. Meanwhile, the U.K. now has more cases than France. This change happened over the weekend, with the U.K. having more than 120,000 cases now, and the death toll in France stands at 19,718. Now, in the meantime, according to the latest data, in total, 2.4 million people have been infected by the virus across the world, with more than 165,000 deaths.
All right, so thank you for that. Turning now to Aram, the government here has extended its social distancing campaign, but on a less intensive level.
That's right. So the social distancing campaign has been maintained for another 2 weeks, so until May 5th at the moment. But Prime Minister Chung Se-kyun made the announcement as well as urging for complacency. Here he was speaking earlier today.
If we get complacent even for a moment, we have seen how the coronavirus can quickly spread again and make our fight against it even harder.
I do apologise, it wasn't today, it was on Sunday, in fact, that he made that announcement. But social distancing practices, which include maintaining distance from others in public places, daily sanitising and wearing masks, will be still in place. Guidelines for religious gatherings, sporting fixtures and some other facilities will be eased. The government is maintaining its administrative orders for such facilities that tend to be crowded. The language, though, has been softened, allowing them to restart operations as long as they do stick to these disinfection guidelines. Chung also said that essential qualification tests and recruitment exams will be conducted on the condition of strict adherence to quarantine rules. And he added that going to school in person might be implemented gradually if the situation, after considering the overall situation of the outbreak.
All right. On to the government's second extra budget proposal, which has to be approved by the Parliament. I understand the government is making its case today.
Certainly a busy schedule for the Prime Minister Chung Se-kyun. Prime Minister Chung was to persuade lawmakers today at the National Assembly to pass the second supplementary budget bill. It is aimed at mitigating the economic fallout of the pandemic. Chung was to explain the scope of the more than $6 billion extra budget, as well as the need to execute it as soon as possible. It is an urgent matter, according to the government. The Finance Ministry previously announced the new budget will be used to financially support families of 4 or more in the lower 70% income bracket, with a one-time payment of about $820. Now, lawmakers from both sides of the aisle have said, as part of their parliamentary election campaign, that they will seek to have that ratio expanded so that all citizens could receive a financial support. But rival parties have not yet decided on when they will deliberate on the matter and who will be overseeing such reviews of the extra budget. If passed, the second extra budget would come on the heels of a near $10 billion relief package that we saw Parliament pass last month.
I see. Adam, many cultural events have been cancelled around the world due to the outbreak, but this hasn't stopped some high-profile artists from putting on a show online.
That's right. It's a very star-studded One World Together at Home virtual concert took place over the weekend. It had big names such as Lady Gaga, the Rolling Stones, Stevie Wonder, among many, many others. In addition to musicians, Saturday's event also featured appearances by a number of actors, comedians and politicians who sent words of encouragement as well. The virtual concert was organised actually by Lady Gaga along with Global Citizen, with the aim of raising funds and encouraging healthcare workers at the front lines of this fight against COVID-19. Now, the event raised nearly $128 million for these healthcare workers, as well as regional charities as well. And video footages of medical workers in South Korea were shown halfway through the concert as a tribute to these heroes.
Right, a great show of solidarity right there. Thank you, Aram, for that, and thank you, Soa.
Thank you.
Now, it's time now for the regular briefing on the COVID-19 situation here in Korea. As mentioned earlier, daily cases fell to the single digit this past Sunday for the first time in about 2 months. Yet health officials are calling on the public to keep its guard up amid concerns of a possible second wave of infections, given the increased social contact in light of last week's general elections and Easter services. The social distancing campaign has been partially eased but extended to May 5th. Administrative orders, meanwhile, on churches, bars, gyms and private cram schools are poised to be lifted within strict quarantine protocols. Here now is the briefing.
Let us now begin our regular briefing on the coronavirus outbreak here in South Korea. As of today, the total number of confirmed cases stands at 10,674. This includes 1,006 imported cases from overseas. Out of them, 8,114, which is 76% of the total, have been discharged. Yesterday, we had 13 new cases and a total of 72 more people were released. And overall, we have a total of 2,324 people in quarantine. Yesterday, we had 2 more fatalities. I extend my deepest condolences to those who have passed away and the members of the bereaved families. Yesterday, we had 13 cases, and of them, 7 were imported cases, and we confirmed 6 through the community transmission. And looking at the sources of the past 2 weeks, 56% was related cases, and also 7.9% were infections through these imported cases, and 17.7% were related to hospitals and nursing hospitals. And we have about 15 more additional cases, which is about 8% of the total, which are undergoing investigation. We confirmed 7 cases from the inbound cases from overseas, and a majority of them from Americas. And we are seeing a decline in the number of inbound patients from the Europe region. However, we are seeing a rise in the inbound travelers from Asia and the US. And in Busan, we also identified 1 more person who has been tested positive to the virus. And this person also worked together with a nurse. And the total of... And we also dispatched our personnel team to this hospital in the Busan city, and we are conducting epidemiological investigation. And in Gyeongbu province, Yecheon-gun County, we had 2 more additional cases, and right now we have a total of 37 cases so far. And the KCDC, as of 20th of April, we have identified the number analysis for the 1,006 imported cases. So this stands at about 9.4% of the total of the confirmed cases, which stands at 10,674. And after we had the first case from China, we have seen a surge in the number of inbound patients. And in the original stages, we had a large number of those coming in from Asia, including China. However, it's also increasing from Europe and the US. And from the 2 weeks from March 22nd to April 4th, we had about 620 people who were confirmed as imported cases. And for males, they accounted for about 40%, and the rest were females. And by age, we had 20s, 30s, and 40s by the age group. And also, we had 418 cases confirmed at the airport quarantine, which is about 46% of the total. And after they came into Korea in Seoul, we had about 244 cases. In Gyeonggi-do province, we have 15 of the cases with a little bit over 200, as well as a few hundreds were identified in the Incheon city. And the metropolitan area saw an 84% of these inbound patients. And of the total, 91.7% were Korean nationals, and the rest were foreigners. And of the recent cases, 60 had community infections. And we also see that the community infections through the imported cases is on the rise. The majority of them were family families and friends, as well as colleagues who work at the same office. And also we had a few people who were at the same places and localities of the places that these imported cases visited. And we implemented a stronger measure to screen these imported cases as of April 1st, and there were no further community transmission from the imported cases since then. And in order to curb the further spread of the community transmission through these imported cases, we believe it is very important for them to abide by the quarantine measures. And especially for those of you who are put on self-quarantine, we advise that you need to use your own utensils and belongings. You need to clean and wipe the surfaces of that are frequently touched, and you must at all times abide by the self-quarantine measures. The KCDC, starting from today up until May 5th, has decided to put in place a partially eased social distancing campaign, and especially for nightlife venues and some multi-use facilities, religious centers, as well as other religious centers, we advise you to refrain from gatherings at these places. However, if you have to operate, please abide by the quarantine measures put in place by the government. And as for the private sector, we advise you to cancel or postpone non-essential gatherings. And if you need to take the exam testings for recruitment and qualifications, these will be carried out under restrictions. And as for the public institutions, when it's indoors and when there is when it's outdoors and where there is a lower risk of infections, we will be opening them by phases, and these include the public parks and forests. And also we will have the baseball leagues, which will be running operation without the audiences to reduce the risk of further infections. And the KCDC believes that the less intensive social distancing campaign does not directly translate into the fact that we will transition ourselves soon to the everyday life quarantine. We also continue to urge you to refrain from operations if the facility is indoors and if it can be crowded. And at all times, it is crucial to screen the body temperatures of the users, and also disinfection is very crucial, and air ventilation is very crucial as well. And in order to prevent the further spread of the virus, it is very important to reduce people-to-people contact, and keeping the personal hygiene is very important. If you have to visit closed-door places which is crowded, we advise you to keep 2-meter distance and disinfect your hands, wear face masks, and wash your hands. If you have any suspicious symptoms, do not go outside and do not go to work, and get screened at the testing centers. Today, on the 3 months ago, from today, on January 20th, we had the first ever case of COVID-19 from the Chinese city of Wuhan. And from this, we also heightened our alert level of the infectious disease. And it's been 3 months since we had operated the KCDC. And also, during the 3 months, we also had the screenings on the inbound travelers coming from China, and also we did the contact tracing, and we did a massive amount of diagnostic tests. And we are currently in the process of intensifying our quarantine measures. And due to our special quarantine measures, we were able to confirm over 410 people at the airport, and we were able to curb the spread of the virus. And also at the airport, Incheon International Airport, we had about 70,000 people working there in the front lines of the quarantine officials. However, there were no single case reported among these personnel. And also we were supported by the military personnel, and also we had interpretation services provided by these personnel, and they were of great help. And the quarantine services were also very highly disinfected on a daily basis. And we would also like to highlight all of these heroic acts by all of them. And at the forefront of our battle against COVID-19, I extend my deepest gratitude to all of them for your efforts once again. And my thanks also goes to the public who have been taking part in such intensified quarantine measures. And the quarantine also begins from the day and from the moment of diagnosing a patient at the airport. And also we have been closely cooperating with the municipal governments to curb the further community transmissions. And we also urge those inbound travelers to abide by the self-quarantine measures for the sake of yourself, your family, your neighbors, and your colleagues, as well as the public. So we highlight this once again. Thank you very much.
Right, that was the latest on the COVID-19 situation here in this part of the world. Korea recorded 13 new cases as of early Monday, raising the total number of infections to 10,647. Authorities are nonetheless calling for continued caution against activities that could raise people's chances of contagion. Meanwhile, the number of new infections is on a slide here in Korea, but it wasn't that long ago when the country was fighting one of the worst outbreaks outside of China. A British diplomat based here in Korea was particularly impressed by the speed in which Korea tested, traced and treated its patients. I have Nikesh Mehta, Deputy Ambassador at the British Embassy here in Seoul, live on the line. Hello, Deputy Ambassador.
Hello, very good to be with you today.
Thank you for being with us. COVID-19 has disrupted social and economic activities worldwide. I'm assuming that this unfortunate reality is also the case in the arena of diplomacy, Deputy Ambassador.
My foreign ministry in the UK has set out a 4-point plan for international engagement. And some of those strands are directly relevant to the work that we do in the embassy in Seoul. Let me just outline 3 of those for your viewers. The first is for the UK to understand what countries like Korea are doing and for us to learn those lessons and look to implement those at home. The second is sort of bread and butter for diplomats around the world, and that's to support our nationals. And in the case of British nationals here, it's making sure that they understand the screening requirements that are in place if they come to Korea and to help them to return home if they need to. And the third area is really about the future. What can we do between countries to ensure that we have a good vaccine in place and a good treatment plan? And that's where the British Embassy can help to forge links between researchers and academics in the UK and their counterparts in Korea.
Deputy Ambassador, a Twitter post that you uploaded last month has gained significant media attention here in Korea. In your view, what aspect of Korea's response to COVID-19 impressed you the most?
There's so many things about Korea's approach that have impressed me. And in fact, I tweeted yesterday to say that it was remarkable that Korea had gone from having nearly 900 cases in the middle of February to just 8 yesterday and 13 today. And we're all learning some big lessons from Korea's approach, this approach of treating, testing, tracking using technology. And I know that we are sending back lots and lots of information to the UK so that we can develop similar approaches in the future.
Speaking of the UK, what is the overall situation there like right now?
Well, you can imagine it's deeply, deeply concerning at the moment. There are 120,000 positive confirmed coronavirus cases in the UK, and tragically, 16,000 people have lost their lives. But I know that my government is doing everything that they can to tackle this virus. And we're blessed to have such impressive National Health Service health professionals.
Deputy Ambassador, going back to your Twitter post, you claimed that, and I quote, "We could all learn from Korea's experience." What lessons here can be applied to the UK then?
Well, I think lots of lessons have already been applied, and lots of things have been learnt by the UK from the approach that Korea has taken, but also the approach of many other countries. And just to give you a few examples of that, the way in which we test patients, the way in which we look to monitor people's activities, and the way in which we encourage people to abide by social distancing protocols. These are all things that the UK has looked to other countries and has looked to develop best practice.
One final question, Deputy Ambassador. Earlier this month, the top diplomats of our two countries spoke on the phone about ways to coordinate efforts to fight the pandemic. Do tell us a bit more about that exchange.
Well, it goes back to one of my earlier answers. This is a global pandemic and it requires an international response. And it's so important that countries talk to each other about the best way in which we can do that. We have already seen that the international community can work together to tackle coronavirus. I would like to see a similar level of engagement between world leaders, including the leaders in Korea and in the UK, to ensure that this generation and future generations are not impacted by the existential threat of climate change.
All right, Deputy Ambassador Nikesh Mehta of the British Embassy, thank you very much for being with us today.
Thanks very much. It's been lovely to speak to you.
Meanwhile, findings as of April 19th show almost 22,000 people have tested positive for COVID-19 in Africa, and more than 1,000 have lost their lives. Observers believe the death toll could eventually top 300,000 within the next few months, given the continent's poor healthcare infrastructure, among other constraints. In this next video, we get a glimpse of the situation in Kenya, where a nationwide lockdown is in place.
Hello everybody, my name is Jayesh Pandit. I'm a clinical pharmacist and I live and work here in Nairobi, in Kenya. It's been 5 weeks since Kenya reported its very first COVID-19 positive patient, and I would say that these 5 weeks seem long. So looking over these 5 weeks, the Kenyan government has also actively been putting in more stringent measures to try and reduce the number of infections and the spread of the infection within the country. In Kenya, over a period of time, in these weeks, we've, for the last 3 weeks, seen a night curfew. So from 7 p.m. to 5 a.m. every day, all citizens, everybody have been informed that you should not be out of your houses. So there is that night curfew. And then since the last, I would say about a week, the government has actually tried to zone the countries within our counties. On a normal day, say about 2-3 months or 6 months ago, it would have been a very busy time right now, so the roads would have been busy. But today, it's not as busy. So when we talk about my daily work, of course, we've been affected. Where I work, we've been advised to take upon a work from home policy. So that essentially means that every day I wake up, I'm at home. If there is any need to connect with our office people, it would be virtually with phones, with video conferencing. So video conferences have become the new norm of late. Teleconferencing has also been adopted quite widely within schools. Through virtual classes, we are able to bring the class together and the teachers are able to teach our children. All across the day, we've got between the programs, we have a clip that comes in, how to act responsibly. There are the bottom lines that keep on writing, saying that how we can keep hygiene, how we can talk to our children to make them not be feared about what's happening.
Reach out to the Korean government to learn.
In my closing remarks, all I would like to say that as a pharmacist, I would like to re-emphasize the fact that personal hygiene, frequent hand washing are very important for all of us. Social distancing is also important. To re-emphasize, it does not mean social disconnection, it just means social distancing. Stay healthy and keep safe. Thank you.
Right, and those were some scenes from Kenya amid the COVID-19 outbreak. While containment efforts may serve to keep the virus at bay for some time, ultimately a cure is the only thing that will allow us to return to our normal. Now, if you have any stories that you'd like to share, please do send them to our email down below.
The spread of the coronavirus. The World Health Organization will try to contain the virus.
The novel coronavirus spreads to nearly a quarter of the world.
Hydroxychloroquine and the Z-Pack, I think, is a combination, probably is looking very, very good. And
the president is talking about hope for people, and it's not an unreasonable thing to hope for people.
치료제와 백신은 코로나19의 완전한 극복을 위해 반드시 넘어야 할 산입니다. 우리가 세계적으로 상당히 우수한 수준이고 또 아주 앞서가고 있다라는 아주 희망적인 이야기를 들었습니다.
The race for a cure for COVID-19 continues across the globe, and in today's studio discussion, we delve into these very efforts. I have Dr. Kim Sing-taek from Institute Pasteur Korea in the studio with me. Hello, Dr. Kim.
Hello, nice to be here.
No, thank you for being here. And I have Anne Elizabeth Babe, a freelance journalist for US News and World Report. Hello, Anne.
Hi, thanks for having me.
Thank you for being here. Dr. Kim, we'll start with you. Given the absence of a cure for COVID-19, how are patients currently being treated?
Well, currently, most of the infection is just some mild symptoms. So it's like 80% of most of the cases. So in those cases, the cure, it's not really cure, but like a supportive care for those patients, like just alleviating the symptoms, like a fever and so on. But for some severe cases, as far as I know, the doctors are trying all sorts of the approaches. For example, like trying like a malaria drug, some chloroquine, or like a Caletra, that AIDS drug. And then also even some people are trying the steroid things to alleviate or some prevent some inflammation. But based on the only if the some safety is secured.
I see. Yep. Dr. Kim, it's been 4 months since the first case of COVID-19 was detected. Is it too early for the world's health experts to have made any real progress in the search of a cure then?
Well, I know many people, many experts are actually trying, well, on the global scale, and even just the WHO trying to just organize such kind of movements. But for the vaccine, well, as far as I know, it takes about at least 18 or 2 years to develop. Even in that case, that is successful. And for the drug development, well, just a normal, just a traditional drug development, it takes at least 10 years. but most of the time actually just consumed for just some preclinical and the clinical trials, which is very important to just secure some safety, especially the safety and also testing the efficacy in the humans. And well, so that's the case. And but well, fortunately, at the Korea actually doing very good job, especially for some diagnostics. And then some of the private sector, the companies and the government just rushed just to develop and then just the licensed the diagnostic testing. So that's why we are sort of just successful in some early just prevention of the transmission of the disease in the country.
And there have been various reports of potential cures being tested. Now, among those, what are some of those that have made headlines across the world?
I've seen a lot of heartening news headlines that show a lot of international collaboration and cooperation looking for this cure. Some front runners for countries that are looking into vaccines I see are the US, the UK, Germany, China. But as Dr. Kim mentioned, we should keep in mind that in order for there to be proper testing and vetting, we are some time away from a cure, despite some claims from President Trump and others that we are months away. So we should keep that in mind.
Dr. Kim, has your institute made any progress in the development of a cure so far?
Well, we are actually focusing on the sort of just a drug repositioning, so which is just using the FDA-approved drugs for other just symptoms. In this case, the COVID-19. So what we did so far is we actually screened approximately 3,000 FDA and IND approved drugs. Well, especially we start with the SARS coronavirus because that time we did not have SARS coronavirus 2. So we started with the screening of the 3,000 just drugs with the SARS because SARS and then SARS coronavirus 2 are very similar. So we actually presume that maybe some drugs which is effective against the SARS coronavirus would be effective again or also to SARS coronavirus 2. So in our primary screening, we selected about 35 or so just the drugs. And then plus we included like 15 or so some other recommendation from the infectious diseases specialist. So simply we just screened approximately 50 drugs against the SARS coronavirus 2 once we just obtained this new virus from the Korean CDC. So then we just screened, and then out of this, we actually identified about 20 or so potential antiviral drug candidates against this new just COVID-19 viruses. And we actually uploaded our just manuscript, and then actually we are particularly interested in the two of the drugs which we found. And then one of them, well, fortunately, actually just now on the some sort of just a clinical trial. And then the second thing that we are actually interested in it's a sort of just a parasite drug. It's parasite drug, but at least for the some cell culture experimental levels, the antiviral activity was excellent. But the problem is that the drug is not really absorbed well in our body. So we are actually trying to just develop some measures to deliver that drug to the tissues, especially in this case the lung, to somehow just control the virus, the replication.
I see.
Yeah.
Dr. Kim, what can you tell us about the potential of the anti-Ebola drug to treat COVID-19?
Well, the anti-Ebola drug is currently the most famous one is Remdesivir from the Gilead Sciences. And then I'm actually personally very interested in this drug because some investigators at the United States, actually they just kept pursuing this drug. And then at least for some mouse experiment and the non-human primate experiment, they actually documented some antiviral efficacy. In this case against the MERS. But well, as I told you, the MERS, SARS, and then in this case the SARS-2 are very similar. Those three viruses belongs to the same beta coronavirus genus within the coronavirus family. So personally, I think the drug is very promising, and then many just countries, and then now it's just trying some clinical trials on this Remdesivir at the moment.
Anne, would you say that the US pharmaceutical industry is one of the most advanced scientifically in the world. And if this is the case, would you not agree that they have probably a very important role to play in coming up with a cure?
Well, of the vaccines that are currently in human trials, I believe there are 3. One of them is from the US. So that company, Moderna, I think is from Massachusetts, and they're doing the trials in Seattle. So it does seem like the US has a role to play in this, but I would say that in this case, considering how urgent this is, it's just a matter of looking at which cures are furthest along in the pipeline and maybe focusing our attentions on those, no matter where in the world that they come from.
Dr. Kim, could you tell us about the typical time frame? I mean, you did mention it slightly in the beginning, but the time frame, the procedures that are involved in the development of a cure.
Well, especially for the drug development, as I told you, at least 10 or 15 years. As long, well, in this case, if the drug is successful, well, there are many chances of the drug is just failed along such as the development process, especially because of safety issues. So that early discovery is just we can actually, out of just a screening of like 100,000 compounds, more than like 100,000 compounds, we can select many just hit compounds. But along those development process, especially some preclinical trial and then the clinical trial 1, 2, 3, and many actually potential drug candidates just dropped. So in terms of the private sectors, this is not really, I mean, the high chance business. So it takes a lot of money and then a lot of risk. So that's that's a normal just a business for the pharmaceutical companies in this case.
Is that why we don't have a cure for MERS and SARS?
Well, one of the reasons is that especially for the SARS, that actually outbreak occurred the year 2002 and then 2003, and then in the summer of 2030, it's just all gone. So once it's gone, so it's actually also disappear from the interest of the people. And then, well, so far the SARS has never been a problem so far. So then people somehow just forget. And then for the MERS case is a little bit different because some intermediate host is camel. So in the Middle East area, the camel is somehow sporadically just transmits those viruses to the people. But now this is the 3rd time from the very similar kind of coronavirus. So at this time, I will just somehow situation will change.
And with Korea being one of the world's leaders in tracing and treating COVID-19, do you suppose there's a great expectation within the international community for Korea to play a part in perhaps coming up with the cure first?
There might be. Certainly, Korea has gained international attention for its relatively successful handling of the outbreak, and all eyes are on Korea as to what it's doing to, even with the election, like how to run an election during coronavirus. So in all manner of things related to coronavirus, we're looking to Korea as a leader. I think that Korea did successfully map a genome for the virus. So certainly has a lot of research that's valuable to contribute.
Dr. Kim, what can the Korean government do in close collaboration with the private sector to become a world leader in coming up with a treatment for COVID-19, in your opinion?
Well, I think even just our president also just said, well, we were pretty much successful in the early diagnostics, the development, and then the quarantine. So now we are just pushing for like a treatment and a vaccine development. And I think the role of government is just organizing some public and the private sectors together, and then somehow just avoid some redundant efforts from each sector. The role of public sector is very important to support, and then the private sector, now they can expect, well, we can get the rewarded by these efforts. So that's the very important role of the government at this point. Not only just Korea, but from other countries as well. Nice. And the international collaboration would be also very important as well.
All right, Dr. Kim, thank you very much for those words. Thank you for being here today.
Thank you.
And Anne, thank you for being with us as well. And that brings us to the end of the program for today. On social platforms here, this particular gesture of using your left hand as a base and placing your right in a thumbs up sign on top of it is currently gaining quite a bit of popularity. In Korean Sign Language, this gesture means respect and self-confidence. Last week, health officials here called for a campaign to express our gratitude to all the health professionals on the front lines of the fight against COVID-19 by using this gesture, which they're calling 덕분에, literally meaning thanks to you. It's now a challenge, so do take part and send us your pictures of the gesture through our social media accounts or our homepage, arirang.com.